Yep, recording.
All right. All right. Hello, everybody, and welcome to a special edition of Facebook Live with Mel and Charlie. Today is, what is today? Thursday.
Today's Thursday.
Thursday,
Yep,
October 15th. Today
yep,
is,
October 15th.
I call it D Day. It's the day that Hawaii opened up. And we've been having a lot of questions. Obviously, you can see our special guest tonight, Mayor Kawakami. But we've been getting a lot of questions about the testing protocols, the policies, the rules. And I figured, what better way to answer your questions than to bring on Derek Kawakami, our mayor, uh, who is who I tell you, Derek, thank you, thank you for beating me in the mayor's election, man. Thank you.
Jeez. No,
I
look, we're
honestly,
working together, like no matter what,
you
right?
know,
Like we found a
on a
way to
serious
come
note,
together.
I, I pray for you and your whole team.
Thank
And please know that Charlie and I are very serious when we say that we appreciate what you and your
you.
team
Oh,
has done um, from day one. We brag so much on our show about our mayor and our administration. I think people get sick of it, but they're jealous. The other islands like come steal you, wrap you in a blanket, and take you back to their islands. Oh my gosh! But we just really appreciate
Yep.
uh, the hard positions you took. And and then your team is just phenomenal. So just want to say thank you and thanks for taking time for joining us tonight.
no, thank you. I mean, this is, I think, a good um, display of how we can come together, and we're gonna need this community to come together. I think my biggest thing that I'm gonna be doing tonight is asking people that I need their help on this one. Um, we're gonna from day one to day whatever it takes. We're going to fight for Koi's position on things. Uh, if we're denied at times, we'll deal with it and we'll move forward. But on this one, we're gonna need people to take the extra precautions. I think we were lucky to have a few months of you know I think being able uh to get by with dropping our guard from times to time. I think we have all been able to sort of relax a little. We're gonna have to put our hands back up again during this next phase. So, but let's get rolling. I know you folks have questions. I'm going to try and break it down as simple as I can and do my best. I think what we need to realize is that this is the state's program. We're here to do what we can to support it, but a lot of the questions that people have are going to have to be answered by the state. That is one thing that's going to have to happen. I'll do what I can to answer what I know, but things are shifting, and I don't want to give outdated information because, as we saw this morning, it changed. So I just have to be mindful of not misleading people. Sometimes the best thing is to redirect them straight to the source.
Well, I'll be honest and tell you one thing, Derek, is that number one, I appreciate you being on tonight. Number two, I think, every island probably is thinking the same way as us, and that is how do we protect our community from this start? I was thinking about it and I said, instead of fighting it because this is the state's request, so we gotta do it. It's that's where the call is coming from. But I think we as a community can join together, band together, especially if we do have an outbreak. Just say if we just do have an outbreak, that we locate and try to confine it as soon as possible, and everybody get on board and know that we need to prevent it from getting um, past that berms that we set up around it. That's the only way we're going to defeat this thing, and then we continue to do what we do to keep ourselves safe. But the first question I wanted to ask you was, with this trusted travel partners, it seems apparent that we have 17 travel partners. Okay, 11 of which are mainland based. Three of which you can is found in Hawaii. That would be CVS. Uh, I don't know about Walgreens, but CVS, Walgreens, and Kaiser, as long as you're a Kaiser member. The other six are airline-based testings. So, I guess the number one question I had is 72 hours or less prior pre-test prior to the departure zone coming into Hawaii. So, if I was at Newark, New Jersey, and I take a flight directly to Chicago, I already took my pre-test in Newark, and I'm now heading to Hawaii. But it calls me to stop at Chicago, stay at Chicago O'Hare, catch a flight to LAX, and from LAX to Hawaii. If I'm at LAX, would I have to, because that's the last known departure state, I guess, but I haven't gone outside of the borders of the airport, and I already took a test from my original departure state. Would I be required to take another pre-test at LAX to come into Hawaii? Would you happen to know?
So, from what I understand, and this is what I understand, and people should know that um, we do have some presence as far as when they started formulating the Safe Travels program. Um, the answer is no, right? It's 72 hours prior to departure. Hold on, what is this? Uh, so that is one of the reasons why we took the position that hey, we should test again when they land on Kauai and just test everybody. But no, from our gathering of information, it's 72 hours from when you leave. There's a number of trusted testing partners, and as long as they go to a trusted testing partner and get their tests, um, that meets the merit of the state of Hawaii Safe Travel Program. But as you folks may have heard, um, there were a number of people, and I don't know how many people. I got a rough report back that there were half of the visitors on a flight that had taken a test outside of that circle of the trusted tested partners. Um, and so the state made a call to allow it for today and tomorrow. And then after tomorrow, it's like they're gonna draw a hard line. I think that's gonna be a hard thing to do, but we'll wait and see how it's handled. Um, in my opinion, I told them, ooh, you know, I understand they had to make a quick call. I respect the call, but I think it might be hard to close that door. But we'll wait and see. We're optimistic that something will be worked out. So what they did in essence is basically say for a couple days, there's gonna be a grace period where they're gonna honor, I guess, you know, tests that were taken outside of that circle. So
Any document that says you negative. Well,
I think so.
well, yeah. Well, I mean, it's going to be very hard to validate any real document. Really, it's going to be very hard to validate if someone comes up with, I mean, something on a doctor's office or a clinic's letterhead that says, I mean, if you took the test, you know the paper you get. It puts the type of test and all of that, and it shows the result. So, wow, interesting. I don't know how you gonna close that door. You're right, I agree. But I guess they'll figure it out. So for our viewers, Merrick, for our viewers, Kauai residents, let's try to focus on them for a little bit. A Kauai resident wants to go to Honolulu and spend a day or a weekend. We know the Big Island is completely sorry. Big Island, you go 14-day quarantine regardless. There's no test that's going to get you out of a quarantine on a Big Island if you're inner island. But let's say Kauai wants to go to Honolulu, Maui, Molokai, Lanai. What happens? What should that person do?
So I'm going to go out on a limb and say that well, first, it's still risky to travel, right? So we're still telling our people that if they can put it off, if they can, they should strongly consider putting off travel, especially now, yeah, like it's opening day and there's a lot of glitches that are being identified from our team on our end. And I'm pretty sure that the state on their end, they are also identifying glitches that need to be addressed. So it's not going to be smooth. And I don't think people um, should expect it to be a smooth operation. And it's definitely not smooth right now. They're working through some of the challenges as we speak. And we're also trying to provide assistance where we can. But we can only do what we're allowed to do as far as getting input in. But we don't have our fingers on the keyboard, trying to fix this thing because we're like I said, we're a county and we're limited. So I would say that if you're planning to travel to Oahu, Oahu doesn't have a quarantine. They didn't have one. So you fly to Oahu and you don't have to worry about a quarantine. But coming back home, what Kauai and Maui did is said that to simplify things, we're just going to honor the state's safe travel program. So they would have to go and take a test, right? They would have to take a look at who is the partners in the state's eyes that are legit to go take a test with. From our understanding, they are planning to onboard, I believe, clinical labs and diagnostic labs as trusted partners. So it should make getting a test a little more convenient for our people because there's a number of labs on Oahu and the other islands that they can go in and make a reservation and go and take a test. I want to tell people it's like anything else. I mean, these tests are not like the infinite resource that just grows on trees. So if they run out of tests, as we've seen some of the partners kind of, at least what we're hearing back, it it is what it is. It's like, if they run out of tests, what can you do? Um, so we've always advocated that the state should consider um, opening the door more for other testing partners to get verified through the state to be allowed to operate, because it'll drive the cost down, right, for our local people. And that's what I'm concerned about, is for our working men and women and families that have to travel. We don't want to, well, we would like to see something that's affordable, but yet verified that it's safe. So they would have to go and get a test. I would say the best source of information for people to go and look at is through the state's website, which is the hawaiicovid19.com/travel dash partners. That is where they're going to get the most up-to-date information. They can try and call us, but we are going to point them in that direction, because oftentimes there are changes that are being made and the communication is not the best as far as the state providing information down to us. So sometimes we're on the receiving end of frustration, but we're doing the best we can, right? If they're gonna call the county of Kauai, the people that are answering the phone are county workers or partners that are doing the best that they can with the information that's provided to us. So the best source of information is directly through the state. I have to say that. And it's not
And
to
it,
it's not to punt. It's just
yeah,
like I'm giving them the best advice I can.
yeah, because the things change so often, and trust me, I know I
Yeah.
frequent the state's website quite a lot. And so it's HI COVID-19, right?
Yeah.
The
Well,
abbreviation.
the
It's
link that I have is HawaiiCovid19.com. So if somebody out there can correct me,
no,
they
that
should.
that's the one.
I mean,
Hawaii.
they can also just Google, right? State of Hawaii safe travel program, and then like something will pop up. So, you know, that's the
You know,
beauty of the internet. It's smart enough to kind of capture the essence of what we're looking for and take us to that link.
I looked at that website, and now this is maybe getting your thoughts on it. Clinical labs and diagnostic labs are the labs that will get the result of the specimen taken at a location. So, say like CVS. I don't think CVS has their own labs here locally. I think they source it out to diagnostic, just like some of the hospitals, right? They send it over to diagnostic labs. So I was just wondering, those medical professionals like doctors who participate with either diagnostic or clinical labs, because the doctor's office is the one that's going to collect the sample and verify the sample has been taken. They will ship it off to the lab. The lab will diagnose it, analyze it, and say negative or positive. That's why I'm hoping that if they do it that route, then people can actually have a wider range, like you said, of trusted partners. Because basically, the end run is the diagnostic and clinical labs. They're the ones at the end of that route, the testing route, anyway.
Mhm.
And that would be totally helpful, totally helpful. I think to the community as a whole, as a whole.
Yeah,
Well,
I
CVS is 139 bucks a pop. So I mean, if you're, if you're going to travel, going back to what the mayor said, if you don't need to travel, I mean, we say that every night. Why would you want to travel right now during a pandemic? And now, as you said, Mayor, because of what's going on and this program being rolled out, and we saw the pictures on the governor's press conference of how crowded Honolulu Airport is, and I'm sure Kauai was no different. In fact, I heard at one point there was like 5 flights that came in at the same time in Lihue Airport, and it was a mess. So why would you want to be in that kind of environment anyway? So, but if you must travel, like I said, I got a friend that has to go to Honolulu to hand carry or hand pick up his medical records. He doesn't have a choice,
yeah.
and he's going to go for a day. So he goes to Honolulu. He's got to schedule that test ahead of time, get a test on Oahu to avoid quarantine when he comes back home. Correct?
Yeah. Yeah. And and that's the thing, right? This is like America. Um and I'm a patriot. I don't always agree with government, which is kind of ironic, right? Because I'm government. But I do still believe that we're the greatest country. And that's my opinion. I back up this country as best as I can. People like they value their freedom. That's what are the foundation of what America is. But the last time I traveled was March 9th or something like that. And we want to. Believe me, traveling is one of our passions. And hindsight is 2020, right? There are times where my wife has said, "Oh man, maybe we should have used that window to go to Oahu." And and I agree, hey, there were these windows of opportunity that it was relatively safe to boat and go get a taste of that freedom, but we decided not to. We made sacrifices. But there are some people that gotta. I understand. They have to,
Mhm.
yeah.
Let
Um,
me ask you, Mayor, what about those that have doctor's appointments from Kauai to Honolulu, and then they come back? So they have, their doctors are in on Oahu. How
yeah,
how how is that being handled? Do they apply for exemption, or
yeah,
no exemptions are given?
yeah. I mean, it's the same. From what I understand, it's the same, right? It's we don't want to discourage people from uh, getting the medical attention they need. And then if you're a Kaiser, if you're on Kaiser, I mean, you have to, right, go to Oahu at times. I mean, that's the way that insurance provider and that health system is set up. is that it's a more affordable option. That's why people jumped on Kaiser. But the thing is that oftentimes you have to fly up. It's the same as like the critical infrastructure workers. They, from what I understand, it's business as usual. But it's more. What happened was the state focused on the Con-Am travel, right, mainland travel, but then the inter-island travel wasn't really addressed until recently, where Maui and Koi said, "Hey, we'll just if the state is going to handle it through the safe travels, that's the simplest way." Um, and so that is sort of where the confusion is coming in, right? For the people that just want to travel for recreation, how do they get away from a 14-day quarantine? And it's the same as mainland travel. You got to get a test 72 hours, even if you're going there for 48 hours, which means you might have to quarantine for a day or two when you land on Kauai. But then when that test result comes back, it unlocks the door for you to be able to get out of that 14-day quarantine. We still stand by the position that it's always best to have another test done when they land on Kauai. And that is why after our Rule 18 was denied, we're working on, the Take 3 test. That's our request. It is a voluntary-based testing program. We're working through our Office of Economic Development to get incentive-based programs lined up to incentivize people to go in and get a test. And then, as you heard, Lieutenant Governor has a surveillance testing program that he's going to stand up for all the islands to help testing presence as well. So,
Yeah, that was a little shaky today when they tried to explain it at the press conference. They're looking at starting the surveillance testing on day 4, but it doesn't sound like they have the logistics in place right now. I honestly don't think it'll even start on day 4, but we'll see what happens. We'll see how many of the guests or visitors want to volunteer for that 4th test. Is there a chance or a possibility that you think that the governor, and I'm just thinking for the local residents that are forced to travel, uh, when I checked CVS, there was some time slots open. In fact, when I checked this morning, there was only one site open on Oahu, and I was in Waianae. So, is there a chance or a possibility that should someone have to go to Honolulu for a day or an overnighter, and they've just for whatever reason could not get a test, could they? I know it's not allowed now, but somewhere down the road, is it possible that we may be able to have that person take a test on Kauai in quarantine until those results come back?
so maybe, I mean, not to like just kind of skirt it off, but um, th- that is sort of like what we were proposing, right? It was like, hey, we don't really care if you took a test or not. We were always basing it on the best health based sort of information, but then also pragmatically and operationally, we knew that opening day was going to have some big glitches as far as being able to tell who took one, did they take a test at the right place. And so in essence, we were saying quarantine for 3 days, we'll get you a test, and then hey, that'll get you out. But the governor made it clear that um, we're not allowed to have somebody land in a quarantine if they took a test, right? They cannot land in a quarantine and then we test them again, because that is not the assurances that he gave um, the general public. So I'm not sure. Things may change as some of the challenges start to really bubble to the surface with this program. So he may pivot and shift, but we're gonna do whatever we can. But communication down to us hasn't been ideal. Like it's not the best that we could ask for. Um, but we're hoping that it improves. So it makes it hard, yeah, on our end if we don't get clear direction and communication. So, you know, we're just asking for people's patience and understanding. We're doing what we can do on our end, but it's challenging. I think it's just challenging all around. Um,
What's what's your anticipated time? I mean, it's a really hard call to make. But what's your anticipated time that you think things can get somewhat tapered off to make it a little bit more manageable without all these audibles being called in the last minute? I know it's a loaded question, but maybe give some kind of time frame in your estimation, because I know how you operate. You try to get things as focused as possible once you open a door and say let's go. But it's always been my impression a state, we started to think of all these questions when they were ready to open up, but it was the 11th hour, really couldn't do much. But some of the things are coming through fruition that we thought was going to happen, but we're hoping that they caught on and they'll make some changes. But I just wanted your opinion.
Yeah, I think well it depends, right? Because we identified like Alan Clinton and our team. So Alan is, he was in planning as an intern. He came back to Kauai, and I tell you, the guy is like just a tremendous asset. He's young, he's smart, he knows how to pick apart programs and reverse engineer it and then pick out like where he sees big flaws. He's been able to identify things, and I would like to share it, but in the name of our public health and security, I don't want to give people that are looking to game the system, like, you know what I mean, like just flag out like where the weaknesses are. But put it this way, we compiled a list, and we have been from the beginning. We bring it to the attention of our higher ups. How quickly they're able to take some of our concerns and adjust to it, or if they're going to just overlook it, that is going to be dependent on how they handle how today went, right? Um, People coming in without having the right test, if they're going to say it's a 48-hour window, where we're going to allow people in, if they draw that hard line and say no, it's going to be rough, right? It's going to be rocky for passengers. They're going to be upset. If they decide to just say, hey, you know what, it is what it is, then it depends. So tomorrow what happens is we go in, the four mayors are going to meet. We're going to be able to discuss what we saw on our end. At 10 o'clock, we have a statewide meeting where all the big departments come in and give reports back. 11 o'clock, it's the mayors and the governor, and we get to discuss one-on-one with him on Fridays, on what we saw and observed. And we're gonna see how quickly they're able to pivot and make improvements, and then be able to adjust and create a smoother operation. But like I said, I think it can only get better, I think. But we're willing to do what we can on our end. So I think that's a big challenge. Um,
Yeah.
yeah.
Well, I
So
mean,
timeline wise, it like hopefully sooner rather than later, like hopefully tomorrow. And already it's improving, right? Like today, the Roberts employees, that first flight that came in, it took them like maybe over an hour to process that plane, that direct flight that came in. But then we had my managing director out there. We had, our team out there to kind of like observe and then make suggestions. And by the next flight and the third one, they had shortened that time from over an hour down to, close to half an hour. So it's already improving as we speak.
any idea how many passengers flew in today? And
I
I know,
gotta
I know we're not over yet. I know still got flights coming in, but
Yeah. I gotta go check with Sue. I'm probably sure, if this was live and not pre-recorded, like either Sarah or Michael would be able to get that number to us. But I don't wanna give a bad number. So I think later on when this thing airs, we can get you that number. Now,
Thank you.
yeah.
Mr. Mayor, I just had a question. You know, some people have had COVID, and it's but they're not infectious anymore. You know, they've done the quarantine and all that. But I guess we've talked about it this before with like Dr. DeWolf, and he made mention. Dr. O'Carroll made mention that you know you still can have traces of it within you, and that's why um, this travel program that the state put had they specifically recommend the PCR. They ask for the PCR test, which we know is ultra sensitive. If someone had COVID and they're no longer infectious, and they take a pre-test, a PCR test, and it comes back positive, but they're not. But you know, we know and the DOH or whoever can and vouch that they had it before sometime, but they still have traces in them. How are you folks going to be handling that?
If they have a PCR test but they came back positive, I
Yeah.
think under the state's program that puts them in a in isolation if they I mean if their results come back as a positive, and so they would land on Kauai, and I'm pretty sure they wouldn't show that positive test result, right? They would be like, oh, I didn't take a test, or they would try to get around it. So they would land in a 14-day quarantine
Well,
because
I guess what I'm saying is we've had testimony. Well, we've had statements, medical opinions rendered that because a PCR test is so sensitive,
yeah,
uh, like Russell Izumo on Kauai, right? He's already done. He had COVID, but he no longer has it. But because the PCR test is so sensitive, it'll probably pick up traces because it doesn't quantify. It
yeah.
just picks it up if it's present or not. And from what the medical experts have said, the PCR will pick it up, even though he's not infectious. Well, that it sounds like it's going to prevent him from traveling. Yeah.
Well, yeah, and that would be like a question that the medical experts would have to vet and then, bring it to the table as far as how the Safe Travels program is going to handle it. But I think because this is a novel coronavirus and we're still learning about it, I don't know if they even have a definitive answer as to the long-term lasting effects, like a cold sore. You can get like a cold sore as a kid, and that's a virus that lives in you. I know because I got one as a kid, but it's a virus that lives inside your body like forever. You know what I mean? And then you can have stress, or you can be out in the sun too long and it'll pop up. And then when it pops up, you're like infectious. So I think they're still trying to determine like what are the long lasting effects of COVID-19. So that question is is it has merit, right? Because yeah, you could have had it and there's trace amounts and a PCR test picks it up and it'll flag you as a positive for a long time. So I think as the tests evolve or as they bring on like other type of tests, it'll be able to filter it out. But for the time being, I think that's something where the experts are gonna have to go figure that thing out. It's not gonna come from me and my opinion on it.
You think maybe it would be something worth discussing with the governor and the lieutenant governor to maybe ask the DOH
Yeah.
what they think? Because I'm pretty sure those individuals, those large amounts of individuals in Hawaii that has had COVID, who are not, they they're no longer infectious, but I suspect they have trace amounts in them just as a residual particle that they take the PCR test and bingo, they're gonna light up, and that might prevent them from traveling. I think that's the question.
Yeah,
Maybe.
and then I'm sure there's ways, right? Like there's probably common sense ways. Like they can probably show yeah, look, I'm showing you that I had COVID-19, so the PCR test is gonna be too sensitive. So is there another test? Like, and I don't know if the antigen test is the right one to refer to, but just for this, example's sake, they probably could say, yeah, I think that warrants me to take another test that's not as sensitive, but it'll give you an accurate depiction on whether I'm COVID-19 positive or not. And then they can make adjustments based on that. So I don't think that these people that got COVID-19 should be restricted from traveling,
Hmm.
just because you know what I mean. This test is so sensitive that it'll flag them.
I
So
think
that's actually something
Dr.
we can bring
Dr.
out.
Fauci made that he made that statement about the sensitivity, and he was talking about that maybe when you're doing a test, if someone had COVID before, you may want to look into a test that may not be so sensitive. So
Yeah.
something to consider.
That's a tough one though, man. I mean, unless you do the test is so specific that it can tell you if you're infectious
Quantify.
or not. Oh my
Yeah.
gosh. I
Yeah,
mean,
because you don't know if they're infectious or not. Right? I mean, I wouldn't know. I mean, like
yeah,
the health experts
with
probably would run me up and down and school me and say like this guy doesn't know what he's talking about. It's true. I when it comes to COVID-19 and the nitty gritty details, I don't know. That's not in my wheelhouse. I just know the general, the general scope of the virus and its characteristics, and then, that's why we bring in the health experts to help guide us. And it'll work out as long as people listen to the health experts and be able to balance everything as they make policy decisions. But I'll bring it up. That's, like I said, like this is like I learned, that's something for us to consider.
yeah, I mean, it's just one of those things. There's a lot of people in America, United States, that has had the virus or has tested
Yeah.
positive. And then the other part, I mean, if you are positive, if you take the test, and let's say you're a visitor and you test for positive, and you get a positive result before you get on that plane, man. If you get on that plane, you're selfish if you get on that plane. Like you said, I agree. They're gonna toss the test result, and they're gonna just get on that plane and come here and take their 14-day quarantine. And while I don't believe the majority of people would do that, I think if I get test positive, I'm gonna be worried about myself getting COVID. So I'm gonna take care of myself. But we all know that you will have those that will say, I'm young, I'm healthy, I'm not gonna get sick, and they will go and take a chance with the quarantine. So it's kind of scary stuff. Um, how long you think before we get the airports? And I know you can probably only speak for Kauai, but you think in about a week we should have everything in an orderly fashion. I think all the kinks. How long before the kinks get worked out? You think? And I'm just talking about as the plan stands today,
So, I
without
mean,
any revisions.
let me put it this way. This is the same program that they were gonna use on August 1st, right? And then it got pushed back to October 15th. And some of the concerns that we had before when they were looking at the August 1st date are still some of the concerns that we have as we speak today. So, like I said, it sort of depends on how the state is going to move forward on whether or not. So, one of the big problems is just the transit flights. So, if you're a mainland flight and you land on Oahu and then it lands on Kauai, there's like two QR codes, right? That square barcode, from what I understand, and there's a glitch. Um, uh, for those flights, those direct flights that are coming in, it's smooth. You know what I mean? It's working. But from what we understand, the backup is when you come in, you land on Oahu, and then from Oahu, you're transferring over to Kauai. So that may be easier to fix. Um, but for the neighbor island situation, as far as safe travels, I think the key is going to be having partners lined up where it makes these tests available for our people to go and get a test locally. That seems to be one of the challenges. And like I said, things are moving quickly. So I'd say that a week is optimistic, but um, but I'm optimistic that it can be a lot better within a week. And that's going out on a limb, right? That is like coming from a mayor who really has no say on how fast the state works on their program. All we do on our end is we're screening the neighbor island side, which is unique. We're the only island where our KPD officers and National Guard, the other islands, it's Roberts. I'm anticipating that it's all going to transfer over to Roberts at some time. Um, so, and then we do enforcement of quarantine. Like, it's hard to say because, in a sense, I'm sort of locked out as to how that program is fine tuned. All we can do is offer up like what we identify as problems, and then we kind of wait and see what's delivered to us, right, as far as a finished product, and then we deal with it on the receiving end.
I have no doubt you guys will do a good job once once the directives reach to you. You folks have proven that you can do the job at the airport and the screening and the quarantine checking and all of that stuff. I think you definitely leaders in the state. So I'm not concerned about that part of it. You know, we'll do the best we can. My concern is just as the numbers rise. They say today we're at 7,000. That's what they expected. I'm not sure what the final count is statewide. How fast will that jump? I don't know. Can we handle 10, 12, 15,000 to the state with the resources that we have? And I'm not even talking about COVID resources. I'm just talking about manpower at the airport and people checking on the people that are in quarantine. I saw in the interview one of the news people did a Facebook Live, and they were interviewing some visitors coming off the plane, and some of these guys just had no idea what was going on. They heard Hawaii was open, and they got on a plane and they came. And so I'm assuming we're still going to have a good number of people that are in quarantine. Interesting enough, there were people that actually chose to not take a test and come and deal with the quarantine, which is pretty interesting.
Yeah,
Surprised to hear that.
yeah, because like the mainland is crazy. Yeah, some places. I mean, you look at
Yeah.
like Portland. I mean, just last year, I was telling Haley that she should look at like Portland State University and schools around the Pacific Northwest, and then like you look around like what's going on now, and then even like with this upcoming election, there's a concern that no matter who wins, it's such a
Oh,
it's such a divided nation in some places that they're looking at like serious civil unrest. So some people are like, they're like, I'm gonna get out of Dodge while I can, and they're just seeking, you know what I mean, a safer place, especially like if they can telework, which a lot of companies have transitioned over. Like they don't mind coming and sitting, you know what I mean, in a safe place, especially, I mean, so that's the reality of what we're dealing with. Yeah, like people are worried in certain areas, and I don't think that's something I could ever fathom because I spent my whole life in Hawaii, and I never I watch the news, and that's why I don't turn it on when I come home because I think a lot of the media they feed off of like fear, and I don't like that, right? But I'm watching the news in other areas, and it's like, oh man, it's hard to believe that's America. Like that's our country. Like you'd expect to see that in other war-torn countries, but it's nuts.
You know when I realized that it's going to get bad in November, when the Lakers won the championship and they rioted and they
Yeah.
looted and they burned vehicles and overturned vehicles. When I saw that city at a point where they should be, then they were very happy that the Lakers had win, and they destroyed their city. I mean, I realized come that general election, we're gonna get some issues, man. You stay home for sure. Do not go out on the mainland. So anyway, we kind of wrapping up the time. Charlie, any more questions for the mayor?
So I know, right? I
He's
think
not,
to
he's muted, that's why.
Yeah, I was muted. No,
oh,
I think this was a very worthwhile time to have the mayor on with us, and just because the scope of questioning is very limited, but it goes to the heart of the some of the problems that was faced today. One is, how do you get a test? When can the test be effective? How do you handle it if you're going just for a day, stuff like that. So I'm glad we kind of answered that. But yes, I think the real point is if we have additional questions, like that PCR question that I posed, that's something we got to bring the DOH in, because I think, because if you think about how many positive cases we had so far this year, right? Over 12,000, 13,000, and they're all okay now. I'm pretty sure 20% of them still have trace amounts of COVID. And if they were to PCR to travel, they're gonna get nicked. They cannot travel because it'll come out as it's positive, but because the test doesn't quantify, they won't be able to tell if you're positive enough, your viral load is enough to infect somebody else or not, and that's not for the airport to consider. So I think they got to look at some ways to maybe allowing, because right now, if I read it correctly, it's only the PCR is allowed and not the antigen right now.
Yeah,
So,
that's what we're kind of trying to get the state to do. And that's sort of like where our position is on Kauai. It's like, sometimes government gets in the way of innovation, and what they need to realize is that competition, it it makes things better. Like it drives companies to compete on price, but then also quality as well. And then by allowing the antigen testing, um, and these are all things that I think the health experts have to weigh in on the level of safety, but it could address what you brought up, is those people that got COVID-19 that perhaps they still are going to test positive on a PCR test. But more so, it allows the free market to sort of operate, and it can create economy here on Kauai and then in the state of Hawaii as well. And then what it does is it makes it more accessible for the private sector, because even the visitor industry, I have to assume that at some point in time, they themselves are going to want to be able to test some of these guests. And I think the employees are going to want to know whether or not that room that they're going in to turn over had somebody with, COVID-19 or not. But in the meantime, we're going to go back to the foundation. And here's where I need everybody's help, is not to like be fearful, but it's just to take precaution. And now would be a time where we have to take extra precautions. And this is where we're going to say that if everybody can wear a mask and just assume that we could possibly be carriers of the virus, we can be relatively safe. And I know it's not a good thing to say, because you don't want to have, just accuse people of being sick. That's not what we're saying. We're just saying that, look, wear a mask, wash your hands, avoid gatherings and physical distance. Now would be the time to sort of take those necessary precautions, because we're moving into the next evolution of the economy reopening, right? The visitor industry. So.
Well, thank you, Mayor. Now is the time for everyone to, I mean, we've been very critical, Charlie and I, and many of our guests that have come on have been very critical of the state. We had hoped that we could have moved that needle a little longer, a little further down the road, hopefully get more safety measures in place, like a second test. We're here. Hawaii is open. So now is the time for us to pay attention and just again, like the mayor said, assume that everyone has the virus, is carrying the virus. Assume that you're carrying the virus, and if you're not careful, you're going to give it to somebody you love. I mean, that's kind of the easiest way to understand how serious this is. And now is not the time to be screaming and yelling about whether a mask helps, or we know that's the easiest, simple thing we can do right now. As we know, we will be getting more virus coming in, no doubt about it, and not just from visitors, but from returning residents as well. So we just got to be safe. And most importantly, stand behind our leaders, our county here on Kauai that's fighting for us. Now is the time for join forces and protect each other. So thanks again, Mayor. Any closing comments real quick?
No, just thank you folks for having me on. Thank you for accommodating me earlier. I'm sorry to the guests that are watching. I know it's so much more interactive and when we're live, because as the questions come in, Uncle Charlie and Mel can pose those questions to me. But hey, thanks for working around my schedule. No matter what, our team is like just fired up, right? I mean, to just make the best of a challenging situation. So we're moving forward. We're getting our second testing program lined up. We're awaiting more details from Lieutenant Governor Josh Green's surveillance testing program. And we're just going to layer different measures of protection and safety measures um, to do what we can to keep people safe. And we just ask that people meet us halfway. I mean, even if you don't like wearing masks, if you could just be a part of this community-led effort, and just be courteous, and and just understand that people may not be as lucky as us healthy ones, and they may look okay from the outside, but we don't know what kind of underlying health conditions somebody may have. And we're one island and we're one people, and together we'll get through this. I know it's an inconvenient time and it's a challenging time for everybody, but this is where we got to band together, as Kauai, as we have in the past, and moving forward into the future.
Well said. Thank you again, Mayor. I know you're a busy guy. We got to get set up for our live session. Town Hall, gonna be fun. Town Hall Thursday. Hopefully we get some fun, exciting, positive stories tonight from our viewers. So with that, thanks again. Stay safe, and keep up the good work, buddy. We appreciate you.
Oh no, thank you very much. Thank you. Aloha.
Aloha.